Thank you very much. Thank you, professors, for inviting me to come and present the story of a very interesting and exciting experience that took place between 2015 and 2016, which is the tailoring immunization programs for maternal influenza vaccination. And here I'll be presenting some of the results. My name is Nthalie, and I am a consultant with the WHO Regional Office for Europe. I hope you can hear me. Yeah? Okay, so my presentation will focus on three aspects. First of all, I'd like to present to you what is the TIP-flu approach. Secondly, I'd like to speak with you about the pilot project that took place in Kaunas, Lithuania. And finally, I'll present some of the key results. So what is TIP-flu for maternal influenza vaccination? TIP-flu was born of an approach which was initially created to address childhood vaccination issues, and which aims to go through a process to prioritize and describe target groups for vaccination, understand the key determinants of vaccination, and using that information, design and implement evidence-informed solutions. In the case of TIP-flu for pregnant women, it was based on the observation that despite global and national recommendations for maternal influenza vaccination, uptake is generally low across the WHO European region, and there was a need to look at how we could develop or adapt the TIP approach to increase uptake. The TIP approach, or the TIP-flu approach, is a collaborative process. And though it may be facilitated by the WHO Regional Office for Europe, it relies on the direct participation and involvement of national and subnational stakeholders. So though I'm presenting here today on behalf of WHO, I have to say and note that many of our partners in this program are here amongst us today, and I'll explain who those partners are. So continuing with the TIP-flu approach, it's an approach inspired by social and behavioral sciences, and also through social marketing models. And these are approaches that have been used for decades now in various health areas, spanning from cancer prevention and control to HIV/AIDS prevention and treatment. So it's nothing new, but what is new is that it's been adapted to vaccination by the WHO Regional Office for Europe. It's a step-by-step process which encourages us to first understand the social and behavioral determinants behind vaccination, and then using that understanding to design solutions towards them. So though this diagram is too small to see, there are significant steps along the way to follow and that help us to make sure that we're going through a comprehensive process. So TIP-flu and the pilot project in Kaunas, Lithuania involved a number of national and county level stakeholders with whom we collaborated. So WHO Euro was really just a facilitator of this process. The Ministry of Health, ULAC, representatives from Vilnius University, including Professor Ambriozaitis here, as well as other representatives from the National Expert Immunization Group, LSMU, including Professor Minkauskene, the National Public Health Center for Kaunas Department, the Kaunas Public Health Bureau, and 3 of the most important polyclinics were some of the main stakeholders in this project. One may ask, why did we choose Kaunas? There was interest from various stakeholders, and Kaunas was chosen, and our site for one of the reasons was thanks to the LSMU experience and motivation to continue their work in maternal influenza vaccination, both via the OBGYN and the infectious disease departments. So here are just some lists of studies that were conducted there. So, as I said, the process looks at really collecting a lot of formative research, and the formative research was collected using a variety of methods, including key informant interviews, meetings with key stakeholders, as well as qualitative research conducted with healthcare providers and with pregnant women themselves, the communities who are responsible for providing and recommending maternal influenza vaccination. And what we found, and this helped us to determine the priority groups and also the objectives, is that there was a need to focus on pregnant women, first of all, obviously, but basically to raise awareness and also knowledge of maternal influenza vaccination first and foremost. And of course, and very importantly, to work with and promote vaccination uptake among their healthcare providers, to provide evidence-based information, to build confidence in maternal influenza vaccination, and to promote healthcare provider recommendation. So the pilot project focused on these two main priority groups. It was implemented in 4 main sites: the LSMU OBGYN outpatient clinic, which also conducted a survey, and primary focus, I would say, on 3 of the largest polyclinics in Kaunas City, recognizing the pathway to care that pregnant women can take for antenatal care. So what was important is to recognize that antenatal care is a process that pregnant women go through, and that the point of contact in their process is multiple. So we needed multiple sites to be able to expose and promote maternal influenza vaccination uptake. Now, the National Public Health Center Kaunas Department also chose to implement the approach throughout Kaunas municipality. So all clinics and polyclinics in Kaunas municipality received educational materials and seminars. Let's see. Am I at the next one? No. Here we are. So what did we do? At the municipal level, we developed communications materials, which were targeted to pregnant women. These included flyers, posters, videos, a hoarding on a bus to inform the public, and therefore to also address families and husbands. There were articles in the press, question and answers about maternal influenza vaccination. Social media was enlisted, and there was technical information for healthcare providers and pregnant women on the ULAC website. In addition to that, we encouraged healthcare providers to carry a badge saying, talk to me or ask me about seasonal influenza vaccination, to stir up a conversation. For healthcare providers, there were educational activities, including letters to clinics, lectures, meetings, articles, conference presentations. And specifically at the LSMU OBGYN outpatient clinic, because a survey was being administered and because we wanted to see the impact of a conversation with midwives, we included interpersonal communications using a case method approach by midwives and the administration of a questionnaire. So what were the results? Now I'd like to talk more about outcome results, outcome evaluation, but also a little bit about process. The outcome results were measured at the municipal level using data from the National Public Health Center Kaunas Department within the county, city, and in polyclinics, and also within LSMU through a study which aimed to assess changes in vaccination coverage and the key knowledge, attitude, and practices determinants after the 2015-2016 influenza season. What did we find? Well, at the county, the municipality and county level, as well as nationally, we found that there was an increase in uptake. So if we look at the Kaunas city municipality here, the data, the graphs show you how this uptake was. On the left-hand side, you have uptake from the Kaunas city municipality, then the county, looking at the county, and then Lithuania. And here at the city municipality level, uptake, just to read it out to you, is close to 3.5%. Now, if we look at respondents from the LSMU study, we reached uptake levels of 14%. This is based on the respondents. And if we look at the polyclinic level, here's the case of one polyclinic which implemented the maternal influenza vaccination promotion. It reached 17% of all pregnant women who were registered during that influenza season. Looking at the LSMU study findings a little bit more closely, we did find a significant change in uptake. particularly in comparison with uptake measures that were taken in 2013, 2014. In 2014, 2015, there was a clinical trial saying, looking at the effects of a leaflet only, and there was 0% change. With tip flu promotion, we reached 14.3%. Now, if we look at why did pregnant women decide to vaccinate against influenza, there were three main determinants that came through. One was high-risk perception. The second was the perception of benefits, both for the mother and baby. And thirdly, the conversation with a midwife. With regard to women who chose to not vaccinate, the main reasons for not vaccinating were issues or fear of side effects for both the baby and the mother, and the absence of a healthcare provider recommendation. This is consistent with what is found through peer-reviewed literature of the very critical role that healthcare providers play in uptake of maternal influenza vaccination. Finally, and this is my last slide, we also went back in February, and WHO wanted to see what were the feelings and what were the results for stakeholders themselves, using interviews and meetings, so this is qualitative. And what we were very happy to hear was that it was found to be a successful partnership in terms of both the process and the way in which it was implemented in Kauna City. And healthcare providers spoke of the fact that a movement was created, that there was a lot more discussion and talking about maternal influenza vaccination. Some healthcare providers, particularly midwives, reported an increase in confidence, and there were reports of benefits of implementing a multi-component, multi-site intervention. Finally, an unintended or unplanned for result of this process, by involving multiple stakeholders and by working together, a result has been that now seasonal influenza vaccination is included as part of new national recommendations for antenatal care. And there is the plan to include this as an item within the National Pregnancy Card. So I would like to thank you on behalf of WHO Regional Office for Europe, and also on behalf of all stakeholders who are here, for inviting me to present. Thank you.